Surgical treatment of ventral hernia in a goat. Clinical case presentation. Surgical treatment of ventral hernia in a goat presented by Professor Dr. Ala Bucks Kachiwal at Dr. Kachiwal Veterinary Clinic and Surgical Center, Tandojam. This clinical case was brought by Mr. Amir Sangrasi from Shahadadpur on 16 March 2026 at 10 p.m. for surgical correction of a ventral abdominal hernia in a goat. This presentation demonstrates the step-by-step surgical management of ventral hernia for veterinary students and practitioners. The owner Mr. Amir Sangrasi brought a goat from Shahadadpur to Tandojam for treatment of an abnormal swelling on the ventral abdominal region. Clinical observation showed a soft swelling on the abdominal wall, reducible protrusion of abdominal contents, no signs of systemic illness. Based on the history and physical examination, the condition was suspected to be ventral hernia. Diagnosis. Diagnosis of the case was performed through 1. Clinical examination. Palpation revealed a hernial ring with reducible contents, indicating abdominal viscera protruding through a defect in the abdominal wall. 2. Ultrasonography. Ultrasound examination confirmed the presence of intestinal loops within the hernial sac. These findings confirmed the diagnosis of ventral abdominal hernia in the goat. Pre-operative preparation. After confirming the diagnosis, the animal was prepared for surgery. Preparation included restraining the goat properly, clipping hair around the surgical site using a hair clipper, cleaning and scrubbing the area thoroughly. The surgical site was aseptically prepared using antiseptic solutions to maintain sterile conditions during the procedure. Local anesthesia. Before performing the incision, the surgical site was anesthetized. Local anesthesia was achieved using injection xylocaine, lidocaine. The drug was administered by infiltration technique around the incision site, ensuring adequate analgesia during the surgical procedure. This step allows the animal to remain comfortable while the surgery is performed. After achieving proper anesthesia, a surgical incision was made at the center of the hernial pouch. Skin and subcutaneous tissues were carefully dissected. This allowed access to the hernial sac and abdominal wall defect. Care was taken to avoid damage to the intestinal structures present inside the sac. Hernial ring identification. Once the hernial sac was exposed, the hernial ring, defect in abdominal wall, was carefully located. The intestinal contents present in the hernial sac were gently replaced back into the abdominal cavity. This step restores the normal anatomical position of abdominal organs. To prevent postoperative infection and peritonitis, injection penicillin, 40 lakh units, was poured into the abdominal cavity. This helps control secondary bacterial infection during abdominal surgery. Closure of abdominal layers. After repositioning the intestinal contents, peritoneum closure. The peritoneum was closed using chromic catgut sutures. Skin closure. The skin incision was closed using silk sutures. Proper suturing ensures strengthening of the abdominal wall and proper wound healing. Postoperative treatment. After completion of surgery, the following medications were administered. Injection Iamix LA 5 ml. Injection dexamethasone 5 ml. Injection hepagen 5 ml. These medications help prevent infection, reduce inflammation, support liver function and recovery. Discharge and post-operative care. The surgical procedure was successfully completed. The goat was discharged at 11 p.m. and transported from Tandojam to Shahadadpur. Owner instructions included: continue prescribed treatment for 5 days. Restrict excessive movement of the animal. Monitor wound healing. Follow up. For proper recovery, sutures should be removed on the 10th day after surgery. The surgical site should be monitored daily for swelling or infection. With proper postoperative care, the prognosis for ventral hernia repair in goats is generally good. Educational note for students. This case is presented purely for veterinary students' knowledge and educational purposes. It demonstrates clinical diagnosis of ventral hernia, surgical correction through herniorrhaphy, proper aseptic surgical technique, postoperative management in field veterinary practice. Thank you for watching. For more veterinary clinical cases, surgical procedures, and educational lectures, please like the video and subscribe to our channel.